Did you know that the #1 cause of death in both men and women is heart disease? And did you know that heart disease, or heart attacks rather, are increasing in younger adults under the age of 40? These statistics are alarming, and with February being American Heart Month, we're learning some important information today about preventing heart disease and heart attacks. Join me now with more is Dr. Dean Yunt. He is an interventional cardiologist with Ochsner Health. Hello, doctor. Thank you for being here.
Hey, thank you for having me.
Well, I am so surprised by this. #1 cause of death in both men and women being heart disease. Why is that, doctor?
Well, you look at heart disease has been prevalent in general, but as we are leading to less healthy lifestyles, obesity, smoking, all the other things that lead up to heart disease, the risk factors are increasing as well, and that's led to an increase in heart disease.
No, it's so true, and I'm curious because, I don't actually know the difference between heart disease and a heart attack. Do I need to have a heart attack in order to get heart disease? Let's talk a little bit about that.
Well, a heart attack is just one type of heart disease. There are other types of heart disease, whether it be heart failure or abnormal rhythms, but a heart attack is when you start having damage to the heart muscle itself.
Very interesting. Now, on top of it being the #1 cause of death in both men and women being heart disease, I also mentioned that we are seeing more younger people have a heart attack. Is that also because the risk factors are becoming more prevalent in people my age and younger?
Exactly. I mean, you think about it, we hear about the obesity epidemic. Obesity leads to diabetes, high blood pressure, sedentary lifestyles. All those contribute to heart disease.
No, it's so true. So let's talk a little bit more about the signs and symptoms of heart disease and a heart attack. What can you tell me? What do we need to know if this is happening to us?
Right. Well, the classic thing people think of with a heart attack is chest pain, the elephant sitting on your chest that everybody talks about.
Angina pectoris.
Exactly. That's a technical term. But that's just the typical symptoms. There are other symptoms that can be more subtle that you may not realize are heart disease. Shortness of breath is a big one. I can think of one patient I had whose symptom was a sore throat, he thought, and it was a heart attack. You can have abnormal heart rhythms, you can feel your heart racing, you can have trouble just feeling bad. Indigestion is another classic one. Not everybody follows the textbook and has the typical elephant on their chest.
Right, and you all are seeing some of the heart attack warning signs right there. And listen to this statistic, everybody. About every 40 seconds, someone in the U.S. has a heart attack. So, doctor, if someone has a heart attack right in front of us, right, what do we do immediately? Of course, call 911, but what else should we do?
Well, unfortunately, the problem is making that diagnosis of a heart attack. You can have symptoms of a heart attack, but until you're under medical care, you can't make that diagnosis. It requires tests, EKGs. They can be done rapidly at a hospital. So the most important thing is calling 911 and getting to an emergency room. People think about, should I take an aspirin or not? You can't say that for everybody, because aspirin, although it seems rather benign, can cause a problem in some people who aren't having a heart attack. It seems rather benign. It's unusual, but you do want to make sure that diagnosis is made and not try to treat yourself.
So the best thing to do, call 911, stay by their side, and wait for the ambulance to come.
Exactly.
Good to know for sure. Now, I got to ask you this as well. I always find that on social media, on TV, on movies, we see certain things happening when someone has a heart attack. But there are some things we can do to help lower our chance of heart disease and a heart attack. What should I start doing right now? Because I don't want to fall into that category, doctor.
Right. Well, we talked earlier about some of the risk factors, but it's maintaining a healthy lifestyle. It's making sure you have regular checkups with your doctor so you know if you have the risk factors. If you don't go see a healthcare provider, you don't know what your blood pressure is. You need to get your cholesterol checked. You need to know what your blood sugar is. You need to exercise, maintain a good weight, and importantly, stop smoking. If you're smoking, you should stop smoking.
What is the thing about smoking? Because I see that a lot on commercials and again on social media, talking about how smoking attributes to heart disease, heart attacks. What's happening there?
I mean, heart disease is just one of the problems that smoking causes, but smoking it makes your platelets, the clotting of your blood, stickier and more likely to clot, which can cause a heart attack. It causes progression of the plaque buildup in your arteries. That's what leads to heart attack and a variety of other problems, strokes and problems with circulation in your legs.
Oh, we don't want none of that, okay? It's 2024,
Yeah.
2020 more, everybody. We want to be around for the rest of the year. And I got to ask you this. Say someone is diagnosed with heart disease or they do have a heart attack. How do you all treat them? What happens there?
You know, it depends on the type of heart attack the patient's having. It could be a combination of medications, minimally invasive procedures like balloon angioplasties and stents, or even open heart surgery. All those are possibilities, or it could be a combination. It's really making the diagnosis, deciding what the blockages look like that have led up to the heart attack, or what other problems may have led up to the heart attack that need to be treated.
And if there is maybe a parent who has had a heart attack, heart disease, is the child more likely to fall into that because of risk factors as well, and just, you know, it being in their genes?
Absolutely. Family history genetics is one of the risk factors for development of heart disease. And so it's important to know what your risk factors are. Unfortunately, that's one of the risk factors you can't change. You can't change your family history, but it's all the more important to take care of those other risk factors.
Come on, everybody. This can happen to anybody, so it's important that we talk about this, especially during American Heart Month. Thank you, doctor, for being here as always. And look, if you want more information about all the things they're doing, they actually have a fundraiser coming up, everybody, the Red Tie Affair. It's Friday, March 1st at the Windsor Court. Ochsner.org/Red Tie Affair is the website to pick up your tickets. And for more information about heart health, you can log on to Ochsner.org/cardiology or follow them on social media.